Hi, my name is Jacqueline Vidos and I'm doing a public service announcement on human papillomavirus. Human papillomavirus, also known as HPV, is a collection of viruses that cause warts on the hands, feet, genitals, and genitals. Some HPVs are sexually transmitted and also cause cervical cancer. At least 50% of people who have had sex will have HPV at some point in their lives. Health experts estimate that there are more cases of genital HPV infections than any other sexually transmitted disease in the United States. According to the American Social Health Association, approximately 5.5 million new cases of sexually transmitted HPV infections are reported every year, though 6.2 million new infections are estimated to occur. At least 20 million people in the United States are already infected, and most of them may not even know it. At least 50% of sexually active men and women acquire a genital HPV infection at some point in their lives. By age 50, at least 80% of women will have been infected with genital HPV. Who can get HPV? Anyone who has ever had genital contact with another person may have HPV. Both men and women may get it and pass it on without knowing it. You are more likely to get HPV if you have sex at an early age, many sex partners, or a sex partner who has had. What are the causes of HPV? HPV enters the body, usually through a break in the skin, and then infects the cells in the layers of the skin. The virus then multiplies in the body. HPV can be transmitted by skin-to-skin contact through a cut. What are the symptoms of HPV? Many people who have contracted the HPV virus will not know it because they may not have any symptoms at all. Others with HPV may get skin warts, genital warts, cervical dysplasia, and cervical cancer. The warts are not always visible on someone who is infected with HPV. HPV can cause infections and lesions in other areas of the body as well. Though they can be embarrassing, the majority of HPV infections are generally harmless. There are two types of HPV: low risk and high risk. HPV types are classified into low and high risk based on their association with cancer. Low risk types most likely will not cause cancer. High risk types have a greater chance of causing cancer but do not necessarily lead to cancer. Genital warts associated with HPV can be raised or flat. They can also be small or large. Colors vary, including pink or flesh-colored. They can appear in the cervix, scrotum, groin, thigh, anus, or penis. Though there is no cure for HPV, the infection often clears up on its own. However, if the infection does not clear up on its own, treatment is needed. Treatments for HPV include cryotherapy, which involves freezing the abnormal cells with liquid nitrogen; conization, which is a procedure also known as cone biopsy that removes the abnormal areas; LEEP, or loop electrosurgical excision procedure, is when the abnormal cells are removed with an electrical current. The goal of any treatment is for HPV to remove all of the abnormal cells, which will remove most or all of the cells with HPV. Other treatments for genital warts include prescription cream from their doctor for patients to apply on their own. Doctors can provide other treatments for wart removal. These options are trichloroacetic acid, a chemical applied to the surface of the new wart; surgical removal, cutting the cells out with a scalpel; electrocautery, burning off the warts using electric current; or laser vaporization or excision of the wart. Thank you for listening. Hope you learned a lot about HPV and enjoyed my video.